Well, one of the challenges as a former frontline provider in primary geriatrics and palliative care, one of our challenges for years in the field has been how to recognize that work that happens in the exam room, talking about goals of care discussions, advanced care planning. And happily, CMS, Center for Medicare and Medicaid Services, initiated an encounter for that they're willing to pay for starting in January of 2016. Our health plan actually started paying for that a year ahead of time, so we've had a little more experience with that, with how to actually implement that encounter and how to operationalize that from a payer standpoint. As I am out talking with a lot of our provider groups, I'm finding that many providers aren't familiar with the rules of that code. So, and there are a couple of codes. There's 99497 and 99498 are the two CPT codes that are now enabled to allow payment for goals of care discussions. Unlike most all CPT codes or encounter codes that CMS uses, these are add-on codes. So in general, whenever you have an encounter in the office or in the home or in the hospital or nursing home setting, you're only allowed to bill one encounter per day per provider. The good news is Medicare recognized that there's a lot of regular clinical work going on too, and there's also likely a goals of care discussion separate from that. So the goals of care codes you're allowed to use in addition to a standard office visit or a hospital consult or a home visit code. It's one of the rare instances where you can bill two codes for the same provider, for the same patient, for the same day, and get reimbursed for both. So that's one of the messages I've been taking out to our provider groups, many of whom tell us that, well, they've decided not to use those goals of care codes because they may reimburse a little less than a consultation code, for example. The good news is you can get reimbursed for both the consultation and the goals of care visit. It's also an interesting aspect of Medicare's rules and private payers' rules too, that it's one of the few codes that you can bill even if the patient is not in the room. Medicare has a face-to-face rule for almost all encounters that they only pay for visits when the patient's actually in the room with the provider. In this case, the patient doesn't have to be in the room. It has to be about the member, about the patient, but the patient might not be there. So you can have a family meeting without the patient present, and for a variety of reasons, that's sometimes the right thing to do, and you're allowed to code for this even if the patient's not actually in the room. So that's something that is unusual in the Medicare rule book, that they'll allow for this even if the patient's not present, and they allow for it as an add-on code with other codes. It's also the same code is used in all places of service in Medicare lingo, so hospitals, nursing homes, assisted living, home visits, clinic visits, all of those use the exact same code with the different places of service annotated to the end. So it's intended to be simple and intended to be broad and inclusive, but I'm finding as I'm talking to providers, many of them don't know those rules, and because it's an unusual case too when an insurance company is out talking to a provider group trying to educate them about how they could bill us for more money. But that's exactly what we're doing with this, is trying to train providers how to use this code appropriately within the rules, but the rules actually are broad and it's inclusive. And so I'm trying to educate our provider community about how best to use this so we can actually compensate them for the work they're already doing.